Hello nurses, this is Kevin with Nursing KAMP.com, and these are my scribble notes on nursing and the NCLEX. This is cardiac lecture number 31, heart failure, right-sided, to pave the way. Found on social media as Nursing Camp. Alright, let's get into it. This is from my sticky note. It was pretty exhaustive, like I said. I'm kind of breaking it down to for this lecture to kind of break it up into different sections. Alright, it can be found on social media, Instagram, Facebook, Pinterest, and Etsy. And here we go. Alright, so we talked in the previous lecture, we did a general overview of what is going on with heart failure. So CHF, the first question is patients admitted with CHF. The first question is that which side? Is it right-sided or left-sided? Because if it's just a CHF question, that's a generic question. So if they say they're admitted with right-sided heart failure, it's acute. That's about right-sided problems. Where if they say they're admitted with left-sided heart failure, well, that's more acute than right-sided. Okay? So, and we're going to talk about the differences. We talked about the differences in the previous lecture, lecture 31, but I'm specifically talking about the right side. And the right side is the right side of the heart. No kidding. So we divided the sections into right-sided versus left-sided. We said right side is more chronic, where left side is more acute. It's acute because of the lungs, and it backs up into the lungs. So what's a patient to look like? Well, the big thing about this is that when a patient has right-sided heart failure, the issue is that it's going into the heart. And the problem is that when it goes into the heart, it doesn't get pumped from the right side, okay, to the left side, to the lungs. It actually starts to back up. And it starts to back up into the peripherals. That's why you start to see edema. So I like to say the right is the rest of the body. Because what happens is at rest, they're filled with fluid. First signs and symptoms is that they start to get edema. Okay? And not only does it start to go into different degrees, see my pitting edema lecture, but what happens is that they start to get congestion in their organs. Like their liver gets really congested, and their spleen, that's called hepatosmegaly. And what happens is that because of that, they start to get a little bit nauseous. And they feel full, bloated. And they start to get ascites, which is swelling of belly. So everything starts to fill up with this fluid. And you start to see this anorexia. They don't want to eat. So if you have a patient with CHF and doesn't want to eat, you don't give them a, hey, figure out your favorite foods. The issue is that it's the CHF that's causing the problem. So when do we know it's acute on a right-sided heart failure? Well, this is an interesting concept because you think about this. They're on the right side. So anytime when the +3, edema is definitely acute, what does a patient look like? Do you see jugular vein distension? JVD. Greater than 4 cms. See my JVD lecture on that. So if you see jugular vein distension, that's code for right-sided heart failure. Alright. So when the patient presents with heart failure, what are some things that we do for that patient? Well, it depends on if it's right-sided or left-sided. So the first key is that, what's the patient look like? How's their oxygenation, right? So we put them upright. We have them sit up. So that they can better aerate. Right? We may elevate the legs as well. But that will also cause fluid to come back, right? So the problem is that there's too much fluid on board. And you need to deal with this fluid. And the way that we deal with it is that we kind of give them try to put them into a fluid deficit. And we say, okay, well, you're normally putting out 30 cc's an hour, but because your heart isn't working, you're starting to build up too much fluid in here. So instead of being a normal 55% fluid over 45% on a blood tube, you're 65%. You have too much fluid in your plasma. So we say, okay, well, let's give you some Lasix and decrease this amount. And so what happens is that they decrease this amount and they keep them at a deficit. And what happens is they start to urinate. And then what happens is that they start to urinate and they start to decrease the fluid. The problem is that they're at risk for hypovolemia. They're also at risk for being dizzy. Okay, because Lasix focuses on the preload before the heart. That's a ghost. So preload. There's also Bumex, and we turn that sideways, and we have 4. Bumex is 4 times Lasix. 4 times as stronger than Lasix. So always remember that. You're given Bumex, that's more acute than Lasix. See my Lasix lecture where I cover that. Some other things. Let's run through our ACE sleeps with our left-sided, right-sided heart failure. Now, ACE sleeps is a method I do to kind of recapture the content and whether or not I have a understanding to able to evaluate my understanding. And I'll research what I don't know in this section. All right, so I think about it differently. So acute or chronic. So the first thing is I think CHF, right-sided. Is it acute or chronic? Well, it's more chronic than left side, so it's not as acute. But it does become acute when they get JVD or they're pitting edema. So if they have JVD, and that means that they're starting to fill up too much with fluid. But it's generally chronic. How does it start? Well, there has to be damage to the heart, and that damage is caused by a lot of different reasons. It could be valves, it could be an MI, it could be viruses, and it could be a peripheral vascular disease. So a lot of factors could factor into it. What's some labs? Well, here's a thing I haven't really covered, is that in this cardiac fishbone, see my other lecture on MI where I cover this a little bit more clearly, this is the BNP. And the BNP, greater than, it needs to be less than 150. Sometimes you see 100. But if it is greater than 150, they are positive for CHF. See my BNP lecture on that. What's another lab? Not really many others. Anemia sometimes. Eating. They become anorexic. They don't want to eat. It might become nauseous. Assessment. What is the assessment? We went through the assessment. Edema. Prescriptions. Lasix. If it's really acute, Bumex. Problems. Procedures. Not really with this. Balloon pump. If the heart is really, really not pumping. That's the most acute. And what stands out? Well, right-sided is more about the body and just fluid building up. It's not in the lungs. Left side tends to be a little bit more acute. The patient has a comorbidity of a previous injury, and when you're looking at right-sided heart failure, JVD stands out, BNP stands out, Lasix, congestion-like symptoms, anorexia, and nausea. Some things that we do for the patient is we put them upright, we give them Lasix, we focus on the urine output, and we monitor for drying them out. That's about it. My name is Camp, and this is Nursing Camp. You can be following me on Instagram, social media, Pinterest, and nursingkamp.com. That's it. Nurse on.